Hi, and welcome back. It's been a while since we've seen you. We're Community Mental Health Care. My name is Miles Riley. I'm the Marketing and Fundraising Director, and I'm here with Gwen Malquit, who's the Behavioral Health
Clinical Director.
I wrote it down, and I still forgot it.
You got it.
Yeah, we're not big on titles around CMH, so
We're just Gwen and Miles.
yeah, we work together. So what we're here today, we're going to do a rather quick update on what's going on at CMH. We have a lot of things going on and a lot of new services to talk about. And then we're going to move into a conversation about the differences and I think there's some confusion about what the difference is between counseling, psychiatry, and psychology and what those services look like and what you can expect if you're scheduled with one of those providers. So I just want to start off with a couple announcements. One, we do have a 24-hour crisis hotline. This hotline is, crisis is maybe a strange word to apply to it. It certainly is there for those people who are experiencing a crisis, a behavioral health crisis, but it's also there for information as well. So if you're wondering what next steps or what services are available in the community, that crisis line is a great place to start, and they can direct you to the places or the different agencies, whether it's CMH or other agencies in the community that can help you out. So I'm going to give you those numbers. This time we brought our cards so we wouldn't look, so we'd remember. But the Tuscarawas County, there's Tuscarawas County and Carroll County. We provide this service. The Tuscarawas County line is 330-343-1811, and in Carroll County, it's 330-627-5241. And again, those are for behavioral health crises, as well as a good information line and a jumping off point if you do have any questions about you or a loved one who may be needing some services. So,
And I'll just throw in there, Miles,
yeah.
the crisis line is completely confidential. And it's a great place to call if it's not you that's having a problem, but maybe a loved one, family member, or a friend, and you need some information on how to help them. So,
great. So, want to also talk about some more topical things with COVID-19. We do have Community Family Health Center. That is a program of community mental health care. It's located behind Taco Bell off the boulevard. If you don't know where that is, you'd be the only one. But we are offering primary care and dental services there. And here with the onset of the pandemic, we were able to offer antibody testing and nasal swab testing. And those nasal swab tests are a little bit different than maybe the hospital or some of the other places you've gone. These are the frontal nasal swabs, so a little less invasive. But the antibody test will tell you if you've had COVID in the past and your body has produced those antibodies. And the nasal swab will tell you within 48 to 72 hours if you're actively fighting that virus. So if you have any questions about that, you can call the health center at 330-365-1781. Also at the health center, we have a Bridges program, which is a medication-assisted treatment program for those individuals who are battling opiate or alcohol addiction. We have seen an increase during the last 8-9 months of overdose deaths, and just general EMS calls related to overdoses. So we're starting to see a pretty significant rise. We're working the Anti-Drug Coalition, the Opiate Task Force, the Adams Board, and other agencies in the area are coming together and trying to figure out a new plan on how to tackle this. If you're wondering where you can turn to start your treatment, CMH or the health center is the place to call. We can get you in and start treatment and start your road to recovery. So same numbers apply for that service as well. And then one more thing before we get into the meat and potatoes of the conversation today. In the middle of summer, we launched a new program. I'll show you the flyer here. It is Child and Adolescent Psychiatry. It has been a one of the major gaps of service in the community, much needed service. So this and we'll talk a little bit more about what psychiatry is versus counseling or school-based counseling. This is kind of a partner to those services. This service is available to children and adolescents from 4 to 17 years old. And basically it's, the first bullet point, I guess you would bring up is medication management in association with whatever diagnoses is found out. Some of those severe or persistent behavioral health issues that require a medication assistant could be, grief. I'm going to just read it off here: school problems, attention deficit, anxiety, anger management, social adjustments, depression, trauma, irritability, and even in autism spectrum disorders as well. So there's a lot that falls underneath that psychiatry umbrella, but that service is available at Dover, at our main Dover location by Cleveland Clinic Union Hospital, and also at our Carrollton location. So again, I'll just throw out the number for information about that. Call 330-343-6631. So those are our big announcements coming in, and we're going to start using this platform to make some more of those announcements of what's going on. And now we're going to get into a little conversation about basically what are the differences between a counselor, a psychiatrist, and a psychologist. And I'm just going to open up to Gwen to just kind of lightly define what those are.
Sure. So a counselor is what we call talk therapy. So that's an individual that you're going to meet with on a regular basis. You're going to identify goals that you want to work on, and you're going to work with that individual to develop coping skills and strategies, maybe how to frame things differently in your life, think about things differently. So there's no prescribing of medication from a counselor. A psychologist could also do counseling, but they're probably usually found in a role where they're doing some more intensive behavioral testing, things of that nature, psychological evaluations. They also will not be prescribing medication. So psychiatry is what we think of when we think of that provider who's going to be prescribing medication. So a psychiatric provider could be an MD, a medical doctor, or they could be an advanced practice registered nurse, a nurse practitioner. So, I mean, obviously there's going to be a lot of talking, meeting with a psychiatrist or a nurse practitioner to determine if medication is something that's needed, if it's going to be beneficial. But their primary goal is going to be to evaluate that need for medication. So a counselor and a psychiatrist are going to be working very closely together. So that talk therapy and the medication management really happen as one team. They're going to be communicating a lot. And it might not be that the counselor and the psychiatric provider are at the same agency. We have both services at CMH, but some people choose to have a psychiatric provider at one agency and a counselor at another, and that's okay.
Yeah, one of the things, and just with the people I know who've come through and said, I met with somebody and it didn't really work out. It didn't mesh with that person. I would say, and I almost wish I could make a big poster on the wall, but I know we have enough signs up now with COVID and everything. But one of the things that is really important to keep in mind is if you do come in and you meet with somebody and get the process started and you don't necessarily feel comfortable with that provider or maybe they don't mesh well with your personality, you are 100% enabled to ask for somebody else or to see somebody else. Just go to the front desk. There's going to be no hard feelings from the provider or anybody else. We want you to feel comfortable opening up and being honest and having that conversation. That honesty and being able to open up that way is the best way to find out what coping skills and treatment plans are going to work for you. So
yeah, absolutely. I mean, like you said, starting down that road to recovery, whether it's an addiction issue or a behavioral health issue, that's an extremely intimate process. And for most people, it's not easy to talk about those things, to reveal those things. So that relationship, that intimate relationship, needs to be with somebody that you click with. And we're all humans. I might not click with you. You may not click with him. Most people don't click with him. But
it's true.
But yeah, you're in charge of your own treatment. So yeah, you absolutely have the right and really the obligation to yourself to make sure that you're working with somebody that you trust.
Yeah. And one of the benefits at CMH, with counseling, with psychiatry, we'll also offer the wraparound service of having primary care and dental all within the same system. So, there are cases where I'll just use anxiety for an example. If you have long-term chronic anxiety, and this is just an example, there could be cardiovascular problems that are associated with that long-term, gastrointestinal problems that are part of that long-term, and your counselor isn't going to be able to help you with that, but they can direct you to our primary care physicians at the health center, and that communication is back and forth as well. So we're going toward that wraparound service where we're dealing, with the mind and the body as one, what is called a holistic approach.
Yeah.
So
you gotta treat it all together because it's all part of you. It's
right.
all part of what makes up who you are.
And especially when you get into medications, if there's communication between the psychiatrist and the primary care provider, that's an important conversation because certain medications may not work, and that conversation is happening on a individual basis. So, just something to keep in mind. I'm going to switch into child adolescent psychiatry. Mentioned it here at the top of this segment. It is a new service that we're offering, relatively new service that we're offering. And I want to get more into the struggles that we're starting to see or the difficulties that we're starting to see now that we're a couple months into the school year. I know each school is dealing with their own set of issues and their own set of fears. Every week, I think everybody's, is this the week the outbreak happens? Is this the week where we have to stop classroom teaching and go virtual? We're doing, it's a rolling thing. Nobody really knows what's going to be happening week to week. That inconsistency of being able to see kids on a day-to-day basis is causing strain, and I know this anecdotally, between, or at least making connections between the student and school counselors and school staff, support staff. Can you explain a little bit more about what those difficulties look like and where CMH and other agencies who are also providing school-based services, how are we trying to fill those things, or what can the parents do to make sure those connections aren't getting lost with their providers or school-based counselors?
Sure. Yeah. Well, first of all, I think it's important to, not lose sight of the fact that, like you said, inconsistency, that fear of the unknown, what's going to happen tomorrow. Those fears and anxieties aren't unique to us as adults. Children feel those too. Plus, I think sometimes children are much more in tune to us than we are into them sometimes. So they're not only dealing with their own fears and anxieties, perhaps, but they're also picking up on the adults' fears and anxieties, those adults in their lives, whether that's, their family or teachers. So yeah, it's definitely been a challenge, I think, to make sure that we're keeping those connections between parents and children and families and our providers at CMH. We do have school counselors and case managers at several of the local school systems in the area, but not all kids are attending school in a bricks and mortar setting. So We've had to get very creative. It's a word, creative and innovative. Those are two words that we talk about a lot when I meet with the child providers. How do we make these connections still? How do we not let any child fall through the cracks or let a family feel like they're unsupported? So that might mean that we're doing home-based services. That might mean that we're trying something different in a school setting, different types of groups. I know we're working with a local group currently to develop some programming for Latina girls in the area. It might mean that children are being seen more in the office. So it's really just about what works for that family and that child.
Yeah, and I don't want to neglect the conversation that we have about teachers as well. They're a major player in this, and often they're the ones who start to see, because so many behavioral health issues do start to present themselves in adolescence, that they're often, because of their interaction on a day-to-day basis and with constantly challenging the student, that they'll start to see some signs first. Mm-hmm. And I've talked to teachers, and they don't really know what power they have. As far as, I've recognized this in the child, maybe the parent isn't involved the way that they feel they should be. And with that scenario, and I think it does happen quite often, sadly it does happen, that the teacher can make a referral as well. Anybody can make a referral into these services. The nice thing about being available on a school-based counseling basis is that those folks are in the school. They can make a connection with that student and try to get in there and try to, it's not an intervention, but at least make contact with the student, kind of get an assessment of where things are. So if you're a teacher or a guidance counselor or somebody who's working with the students on a regular basis and have a question about these services, again, call us or talk to your school-based counselors, and they'll help you get guided in the right direction as well. Yeah,
and don't assume that as a teacher that what you might be seeing in a classroom, the parents are seeing at home. None of us are at our best when we're in a stressful situation. So, maybe the home setting is their comfortable, safe place, but school is it's scary right now. Right. So they may be exhibiting behaviors in the classroom that they're not showing at home. So, we don't want to assume that the parents know about this, and sometimes that's the teacher's burden is to bring those things to parents' attention and work together.
Right. And I'll mention here, this is a recorded podcast this time. We typically go live, and people are able to ask us questions while we're going through this. So if you're watching this after the fact and have questions, feel free to reach out through us through Facebook as well. It's going to be either me, JJ. JJ's more qualified to answer some of the questions, me just being the marketing guy, but we are very responsive on Facebook. So that's a real quick, easy way to contact us with some questions about getting into the funnel of service here. So I do want to mention too that our child in Dover, and just make that very clear, in Dover, our same-day appointments for psych services is an active program. We are able to get people in the same day. We don't have those services available on Fridays, but we can at least get you in and get assessments done on a same-day basis. And that's for children, but for adults really is what that program was designed for.
Right.
That's the thought I had on that.
Well, we've said this before in different when talking about different topics, that typically by the time someone makes the decision to finally make that call to get mental health treatment or addiction treatment, they've already waited probably far longer than they should have. So when they do finally make that call, we don't want to give you 500 hoops to jump through and tell you, come back and see us in 2 months. we want to make that connection with a provider happen like that.
Yeah. And I think now more than ever, and one of the, I guess the silver lining of this COVID cloud is we've been able to reach out to people via telephone, through video, and in person as well. We do have safety measures set up for not only our providers, but for those people coming into our building. All people are being screened, and we are asking a series of questions to make sure that our environment's staying as safe as possible. Masks are required, but even on a one-on-one setting with a provider, if it is necessary for you to come in and do a in-person visit, that's going to be a safe experience for everybody. And I know with the last Thursday, Tuscarawas County turning into a red county, which is the next level of risk and contagion. I think those services are available. I think it saves people traveling, saves people waiting around in the lobbies. So our video and teleconferencing programs are all fully running.
Yeah, and I'm glad you brought that up because
thank you. Yeah.
You're welcome. But I think a lot of agencies are handling that differently. So some agencies are doing nothing but telehealth, regardless of whether you want it face to face or not.
Right.
Some are really doing a hard phase out of telehealth and really pushing for face to face. We really want it to be about what's best for you. So yeah, like you said, telehealth, video, face to face. It's an individual decision.
Right. So that's where we are, and I think that's pretty good. At least a 101 of some of the services that are happening right now, specific to counseling and psychiatric services. If you have any other questions, again, feel free to reach out through us via Facebook. You can give us a call. Those numbers, I'm guessing, will be at the bottom of the screen by the time this gets all produced. And I think that's about it. We'll see you, and again, in about a month, we'll be back just giving you some more updates. If you get a chance to see us on Facebook, check out some of the updates that are happening at the health center. Another big news item for us is we're building an addition to the health center, and if you drive over there, you'll see all the concrete being poured right now. We're building a pharmacy that will be able to provide that. That's a new service for us to our the individuals that we see in the community as well, and we'll also have some office space, which is very needed as the continued growth of need in the community. We also need to expand the number of providers that we have. So that'll give us some extra space to do that. So a lot of good things happening at CMH. We're excited to talk about it. If you go on our Facebook page, you'll see a lot of those things that are going on, and we encourage you to engage in that. So Gwen, do you have anything else you'd like to add?
I don't think so.
You want to try to remember the crisis numbers off the top of your head?
I do not.
Okay.
Thanks for challenging me, but no, I'm good.
All right. So wash your hands, be safe, and we'll see you next time.
Bye-bye.